Hi, I'm Shelby Romosier, and I am a genetic counselor here at the University of Iowa Hospital. And it's my pleasure today to give you a little bit of more information about what I do as a genetic counselor and in general what the field of genetic counseling is all about. And I am one of many different types of genetic counselors, and we work in different areas in the hospital and across the state. So let me just walk you through a little bit about what is genetic counseling. So first off, why should you care? Well, genetic counseling is actually one of the fastest, and it might actually be the fastest growing careers currently. Our understanding of DNA and genes, which are the instruction manuals for how to build our body, is exploding, and it's causing us to learn so much about what makes humans humans and why do some people have differences in their growth or health or development. And so we are able to do testing to identify the underlying cause of a lot of different either diseases or health problems or just unique differences seen in humans. And that opens the door for genetic counselors to help explain and understand all of this. So our understanding of the genetic contributions to both health and disease is rapidly expanding, and our research in DNA, and we are discovering new genes all the time, is exploding. Therefore, you yourself or someone that you know will likely see a genetic counselor as part of your regular health care at some point in your lifespan. And so if you've never heard of a genetic counselor before, you may learn more in the future. You or someone you know might see a genetic counselor, or maybe you already know of somebody that has personally met with a genetic counselor as part of their family or health situation. Every single one of us is either a carrier of a genetic condition. A carrier means that we carry differences, what we call mutations in our DNA that can be passed on to our children, or we're at risk for a genetic condition based on what our DNA is, or we have a family history of a genetic condition. So there's something that runs in our family that other family members have that we could potentially have as well. Plus, it's pretty cool, and you'll see why. So genetic counselors, just to be very clear, we are healthcare professionals that help individuals and their families with genetic disorders. And genetic disorders is a very broad umbrella term. It can encompass lots and lots and lots of different health problems. So this is the formal definition of genetic counseling. It is the process of helping people understand and adapt to the medical, psychological, and familial implications of genetic contributions to disease. This process integrates interpretation of family and medical histories to assess the chance of a disease occurring or recurring, education about inheritance, testing, management, prevention, resources, and research, and counseling to promote informed choices and adapt to the risk or condition. Sometimes I tell people, I think a better definition is sometimes I'm a genetic educator. I am a counselor. I help people through difficult decisions and difficult situations. But I'm an educator because I have to help people understand and learn what's going on so that they can make decisions and work through their complex health problem. And also, I'm a genetic advocate. I advocate for people with disabilities or unique health needs to help them get access to the resources or supports that they need. If you have time, you can follow this link that I put down here. It's a YouTube video about I am a genetic counselor, and you can hear from lots of different genetic counselors that work in different areas of the healthcare industry. So just for example, I like to give concrete examples of why someone would actually see a genetic counselor. And I am a pediatric genetic counselor, which means I specialize in helping children. I see children for all different kinds of reasons, both them and their parents and adults and sometimes grandparents even. So someone comes to see me if they are born with a birth defect. I've shown a picture here of this really cute little boy with a cleft lip. That's an example of a birth defect. Cleft lip, cleft palate. We see people born with extra fingers, extra toes. Those don't matter as much as having a big birth defect like a heart defect that affects the way your heart functions, holes in the heart, blindness, deafness. Those are all birth defects. Intellectual disability, which means that somebody has difficulty in their learning and development, and they don't learn at the pace that we would expect. It used to be called mental retardation. We don't use that term anymore. Intellectual disability means individuals who have difficulties with their learning and cognitive functioning. And we can certainly figure out oftentimes what the underlying cause of that is. Short stature, so individuals that are too short. You may know of the term dwarfism. We see individuals that have dwarfism, or individuals who are just shorter than we would expect, not necessarily dwarfism, but just aren't growing well. We also see the other end of the spectrum, overgrowth, individuals that are growing too fast or rapidly. Failure to thrive is a term we use in the medical field to describe an infant or a toddler who's not gaining weight. All of these reasons we can find underlying genetic causes sometimes. Seizures, neurological problems, heart disease. We also see individuals that are struggling with infertility, meaning they're having trouble having a baby or conceiving, or recurrent pregnancy losses, miscarriages. The vast majority of miscarriages are caused by chromosome abnormalities or other genetic defects that we can identify. Cancer. So a huge subset of cancer is caused by an underlying gene mutation that sometimes can run in the family, especially if the cancer is early onset, so in individuals under the age of 50, if it's a rare type of cancer, or if there's multiple people in a family that have all had cancer. You can go see a cancer genetic counselor. Abnormal prenatal ultrasound. So if you're pregnant and you find out that the baby you're carrying does have a heart defect or something looks a little unique or unusual on the ultrasound, you may see a prenatal genetic counselor to help you prepare for that child's birth. If you're a known carrier, so maybe you have a family history of something like cystic fibrosis or sickle cell disease, and you know that you're a carrier for that condition, you might see a genetic counselor to talk about what's the chance my child could have cystic fibrosis or sickle cell disease, for example. Sometimes you might see a genetic counselor just based on your ethnicity. So, for example, let's say you are Old Order Amish and you come from a long line of generations that are Amish, and within the Amish community, we know that there are very specific gene mutations that are shared within that community. So just based on your ethnicity, you might be concerned about the chance your child might have PKU, for example. Or if you're Ashkenazi Jewish, we know there's specific gene mutations in the Ashkenazi Jewish population that increase the risk for very specific genetic disorders. So those are just some examples. Maybe you're seeing a genetic counselor because you just recently got diagnosed with a genetic disorder and you need help and information and someone to explain to you what's going on. So this is often where I step in for a lot of my patients. We see children that we do genetic testing for any one of these reasons, and we do find the underlying cause of their health problems or unique features. It's really a genetic counselor that sits down with the child, with the family, with the person, and explains, what is this? What does it mean? How did this happen? What can we do to help? What treatment or therapies are available? Is this something that's running in the family? Could other family members be at risk or affected? And are there other health problems that now we need to look out for based on this chromosome or gene change? Again, we're reading the instruction manual of somebody's body, so there's a lot we can learn by testing the DNA. Maybe you have a family history of a genetic disorder and you just want to be tested for that particular condition in your family. We see people for that too. Or maybe you don't have any of those, but you're just interested in genetic risks in general. I'm going to skip that slide here. And I wanted to talk a little bit about genetic counselors that are right here in our state of Iowa. We have a growing number of genetic counselors. It's still a really, really small field. So this picture encompasses not everybody, but most of us. There are between 25 to 30, somewhere between 25 and 30 genetic counselors in the entire state of Iowa. 23 of those genetic counselors are here at the University of Iowa Hospital. We have many genetic counselors that work in pediatrics, so working with children. That's what I do. But there's so many different specialties that genetic counselors work in, so you can specialize in any of these different fields. We have genetic counselors that work in cancer, prenatal, neurology, cardiology, nephrology, which is kidney disease, ophthalmology, eye diseases, otolaryngology, hearing loss, newborn screening, which is babies that are born in the state of Iowa have to get a heel poke and get screened for a large number of different genetic disorders that would have not have otherwise been detected. So they're kind of hidden disorders. And if any baby gets an abnormal newborn screen, they have to meet with a genetic counselor. They also work in public health. We also have genetic counselors that don't see patients face-to-face, but work in our laboratories or work in research. And all of those are very important different fields. So you can be a genetic counselor and have a specific interest in any one of these different areas. And by the way, there's many more specialties that I didn't even mention. I just wanted to touch on some of them that are here in Iowa. So what does it take to become a genetic counselor? So to become a genetic counselor, you do have to complete high school and then go to college. And that's often 4 or 5 year college degree. You can get a degree in anything you want while you're at college. I got a degree in biology and I had a minor in psychology. There are genetic counselors that get degrees in any one of the science fields. As long as you meet some of the requirements to be able to apply to a genetic counseling program, it really doesn't matter what degree you get as long as you complete college. And then you'll apply for genetic counseling training programs. Genetic counseling training programs are currently a 2-year master's degree. And there are somewhere between 30 to 40 programs in the United States and Canada. So there's not a ton of different programs, and each program is unfortunately pretty competitive to get into. My class size in graduate school, there was only 5 students. Most programs have between, I think, 10 to 15 students, so not very big programs. So you definitely want to work really hard to build up a good resume and good experience when you apply to your graduate training programs. Once you graduate from genetic counseling training school, you sit and take a board exam to become a board certified genetic counselor. And that is what CGC stands for. So if you see anybody whose name ends with the letter CGC, you know that they are a certified genetic counselor. Here in the state of Iowa, we also just recently got licensure for genetic counselors. So you might also see LGC, which is a licensed genetic counselor. And by the way, I've been talking a lot about genetic counseling, but just to mention, there are lots and lots and lots of different careers in the genetics field. If you're interested just in general about DNA, genes, or genetic testing, you can be anything you want to be. Genetic counselors are mainly the individuals sitting down with the families, talking to them, explaining and helping them through difficult situations and understanding their diagnoses. But there are doctors, geneticists, researchers, nurses, public health specialists, all of these that have careers in medical genetics. And I'm going to stop there. Thank you so much for listening. I did want to mention, if you have any specific interests or specific questions about genetic counseling in general, I encourage you to check out. There are 2 different websites that I would point you to. One is ABGC, which is the American Board of Genetic Counseling. They have wonderful information on their website about different genetic counseling programs. The other is NSGC, which is the National Society for Genetic Counseling. And that's a fantastic resource. For anybody interested in genetic counseling, they have more information there. So that's ABGC and NSGC. And you're always welcome to reach out to any genetic counselor here at the University of Iowa Hospital if you're interested in just meeting with us to learn more, or maybe doing a job shadowing experience too. I hope this has been helpful, and best of luck on whatever career journey you choose.